Are you experiencing sharp pains in your crotch during pregnancy? If so, you're in the right place. My name is Dr. Nicole. I'm a physical therapist and a mama myself, and today we are going to talk all about pubic symphysis dysfunction and the things that we can avoid to make that pain feel a heck of a lot better. If you missed last week's video, check it out in the link above. You can find a video there all about things that we can do to improve pubic symphysis pain. Today we're going to talk about all the things that you should probably avoid if you don't enjoy that sharp pain in your pubic symphysis region, which I'm sure you don't. So some of the things that we know make it worse are a lot of asymmetrical positions. So having your feet not even but apart. And this is why when we walk, especially taking big steps or we go up and down the stairs, we feel a lot more pain in our pubic region, and it has to do with the asymmetry in our pelvis. So things that you don't want to do if you want to keep your pain at a minimum is avoid different exercises like lunges, or maybe you typically use a lunge position to get down and lift a baby carrier or lift your other children at home. If you are normally doing this, you might want to consider a squat where your feet are more symmetrical. This is probably going to be a lot more comfortable for your pubic symphysis pain. You want to avoid things at the gym that are going to, again, cause that asymmetry in your pelvis. So if you typically use things like the elliptical or the stair stepper, or you like to run on the treadmill, but it really makes your pain a lot worse, you could consider things like sidestepping on the treadmill. You could again do squats, you could do deadlifts, you could focus on upper extremity and core strength instead. Basically, you just want to avoid exercises where your feet are in a wide stance and far apart, because these are going to make that pain probably worse. If you live in a 2-story house or a bi-level, tri-level, you do a lot of stairs during the course of your day, you want to try to minimize trips up and down the stairs. So sometimes this takes some planning. For instance, in the morning, you gather a bunch of stuff, you put it in a basket, and you bring it down. Throughout the day, you either recruit your children to make those trips up and down the stairs, or you try to make a list of all the things that you're going to need up there and just do one trip. And like we talked about last week, using a side step instead of a forward step will make it a lot more comfortable. And then finally, sitting down to get dressed or avoiding things where you're standing on one leg. So do the hokey pokey and put your right leg in or whatever. Those kind of things are not what you want to be doing, because anytime you put all your weight on one side, you're putting a lot of strain on your pelvis in that pubic symphysis region, and that is when you are going to notice an increase in pain. The last thing I want to make sure you've considered if you are experiencing pubic symphysis dysfunction is, how are you going to deliver your baby? If you haven't even thought about how this pain will affect your delivery, I highly encourage you to think about it now, because it will. So there's a few things. First of all, avoiding positions where your knees and hips are really wide apart is going to be important to avoid aggravating that pubic symphysis pain. So you need to talk with your provider about what they are comfortable with. So perhaps a position like hands and knees might be something you'd be interested in, because it's not a very wide opening at your hips and knees and could be a lot more comfortable in your pubic symphysis region. However, your doctor might not feel comfortable delivering your baby that way. So you need to talk with them in advance about what you're comfortable with and also what they are comfortable with. The other thing is, maybe you are considering an epidural to just completely avoid the pain that you would experience with pubic symphysis. That is definitely something that could help with pain management. However, if you really are like all the women in the movies and you're laying on your back and your legs are back in stirrups, or a nurse and your support person are holding your legs back and you're pushing for a couple hours, I would be willing to bet when the epidural wears off and you are expecting to be bonding with your baby and focusing on breastfeeding and taking care of them, you are going to be in a lot of pain and probably not moving around very much at all, because a lot of damage is going to be done in your pubic symphysis region and it's going to be super painful. So if you decide to go with an epidural, still be mindful of what position you deliver in. perhaps you could go into a side lying position and you could talk to your support person about making sure they don't hold your hips way far apart, just whatever is necessary for the doctor to be able to catch your baby. And then the other thing is to make sure that between contractions, between pushes, you are putting your legs back down to relax. So avoiding those end ranges where they're just really pulling your legs all the way back towards your head, and then also putting them down between contractions. The less time you are straining that pubic symphysis region, the better. And then if you do experience pain after, make sure you check out the tips in the other video about ways that you can strengthen muscles in that area and protect from doing any more damage of your pubic symphysis dysfunction. That is all I have for you today. If your mind just started turning when I started talking about labor and delivery, I have the tool that is going to be perfect for you. In the description below, I have actually created a cheat sheet of sorts to get you through different complications or issues that might arise during labor and delivery. So for instance, if this position isn't working, maybe you could try this position. If you want to avoid tearing, maybe you should try this position. If labor stalls, try this position. Just some helpful hints that you could talk over with your support person and your provider before you're actually in the heat of the moment of labor and delivery. And I think it could be really helpful for you. In the comments below for the Mom Share All today, if you have experienced pubic symphysis pain, or maybe you are right now, please comment what makes your pain worse so we can all avoid those activities. Because if it makes it painful for you, it's probably going to increase pain for other mamas out there. So why not help them out? Give me a big thumbs up if you liked or learned something in today's video, and I would love to have you subscribe to my channel to learn about all the things pregnancy and postpartum recovery related. I'm super passionate about empowering women with education, and I don't want you to miss a thing. Thanks so much for joining me today, and I can't wait to see you all next week.